So this is a human-sized kidney. I mean, which means that if you take someone who is with like a normal human frame like me or anyone, this is a normal size of a kidney, just about the size of my fist, or maybe a little smaller than that. But this essentially is how your kidneys will look like. This is the adrenal gland, but we are not focusing on that today. We are just focusing on the kidney. And we are talking about why your kidneys or people's kidneys are failing. And if you're watching this, I would suggest that you watch this to the very end. Now, if you open the kidney, you have some structures inside the kidney. So what you see inside the kidney are various structures. And now, these ones here is what you call the nephrons. You see all these things, they are the nephrons. And then you come down here, you see the blood vessels that supply the kidney. Now, the nephrons is a functional unit of the kidneys. So the kidney is just an organ, like any other organ, like the heart, but it has things inside the kidneys, inside of it, that make it functioning. And so when they say your kidneys are working, it's because your nephrons are working. When they say your kidneys are failing, it's because your nephrons are failing. So what you see as a nephron has two parts. The two parts essentially is what is called a glomerulus, which simply is a network of blood vessels. So there's one blood vessel carrying waste substances to the kidney to be filtered, and then another one carrying it away from the kidneys after the filtration has been done, so that the good blood that has been cleaned out is sent back to the body. And so these blood vessels, these two blood vessels, form a mesh or a network, and it's like a head, okay? And these blood vessels fit into something that looks like a cup, okay? So that cup is also known as the Bowman's capsule or the renal capsule. It fits onto the glomerulus. Now these two structures, the glomerulus, which has formed the head, and the renal capsule or the Bowman's capsule, when they come together, that essentially is what forms the nephron, and that's a functional unit of the kidney, which means that one is filtering out, and then the renal capsule is collecting the waste product to a tubule, okay, and then the tubule sends that into the renal pelvis, which is then excreted into the bladder, and then you're able to pass it out as urine. So my video today is because there's an increase in the rate of kidney failures among people in Ghana, especially young people, young black people in a lot of African countries are seeing an increase in kidney failure and kidney disease. And it appears that there are some modifiable life risk factors or lifestyles that can actually help people in reducing their risk or the rate at which they get kidney failures. Diseases mainly causes kidney failures, and there are some lifestyles that lead to these diseases. And so for example, there is high blood pressure, and when your blood pressure increases, what happens is that these blood vessels that I showed you earlier do not get enough blood supply again, or the blood vessels become narrow because there is a deposition of what is called atheroma that leads to atherosclerosis, or the blood vessels become hardened over time from many factors. We are not going to go that in this video. We are not going to go into that in this video, but several factors can cause the blood vessels to become hardened, and so the kidney itself or the nephrons are not able to get adequate blood supply, which is how high blood pressure increases kidney failure. And just like any other part of the body, if there is reduced blood supply, which means that there is reduced oxygen supply, there is reduced nutrient supply, and so that part of the body begins to die, and that is peculiar, or that is not peculiar to the kidney. It is the same as any other part of the body. The next thing is high blood sugar. Now, so in high blood sugar, there is increased deposition of blood sugar or glucose. Now, when glucose gets deposited in the nephrons, what happens is that these nephrons, the glomerulus, which is the sieve part, like the part that acts like a colander that sieves out the waste, becomes occluded and obstructed by the excess glucose deposit. Now, when this happens, the nephrons lose their ability to function properly, and so you don't have them being able to filter out the waste product so that it comes out of your body. It stays in the body, it stays in the blood, because there's a blockade around the functional aspect, which is the glomerulus, which is going to sieve it, is blocked by sugar. And so that causes the kidneys to begin to fail because it's not working as much, and the potency of the nephrons or the ability to work has simply been reduced. The next thing is high cholesterol. And high cholesterol works in a similar fashion like high blood pressure, so that high cholesterol, which is your bad cholesterol or low density lipoprotein, gets deposited in the blood vessels. And essentially these blood vessels get damaged because high cholesterol is not going to allow the blood to flow. It's going to narrow the space of the blood vessel, and so on and so forth. And then there is reduced blood supply to the kidneys, chronic inflammation, and then the kidneys begin to fail. There are also things like glomerulonephritis, which come from infections that happen to the kidneys. So let's say you have a kidney infection, okay? What happens is that some microorganisms can cause infections or can enter into these kidneys, and once there is infection, the body begins to act and fight against the infection. And one of the ways the body does that is by an inflammatory process, which sends a lot of blood cells and other tissues, lymphocytes and all of that to the kidneys to fight it. And in the process, the kidney becomes inflamed, and when it happens over a period of time, it becomes chronic glomerulonephritis, which leads to kidney failure. There is also polycystic kidneys. Some of these conditions are genetic, and it's very common. As much as 10% of people who have kidney disease have a genetic predisposition or a genetic condition that is leading to the kidney failure. And one of them is polycystic kidneys, where you have many cysts developing throughout the kidneys and causing kidneys to fail. You can hear the birds chirping, and so forgive me if they're disturbing you, but I'm enjoying it. Okay, so let's go into what actually causes these lifestyle diseases that are things that you can modify, because there are some of these things you cannot control, but there are some of them you can actually control. Okay, and today I want to talk about those lifestyle disease choices that you can control. Okay, so that your risk of developing kidney disease goes down. Now, the first one is poor eating habits. Okay, now a lot of people eat foods that are high in things like cholesterol, fat, that end up building your cholesterol. And like I said, that is going to increase your risk of developing hypertension or high cholesterol, which is going to cause you to have reduced blood supply to the kidneys, and then you have kidney failure. There's also a lot of people who eat a lot of snacks that contain a lot of sodium. And I can tell you that any of those foods that are packaged and bagged, like things like potato chips, things like cheese balls, any of those fast packed foods, okay, the ones you buy in the grocery shops and the supermarkets, a lot of them contain sodium, and some of them have absolutely harmful substances that destroy your kidneys. And so you need to watch the way you eat, and also eating foods that are high in sugar. For example, you take a lot of ice cream when you're about to eat. Some of these foods contain so much sugar, and they end up building up in your kidneys, and they reduce your kidneys' ability to function properly, to filter out the waste substances. And as that happens over a period of time, what happens is that your kidneys begin to lose their ability to function. Now, the second lifestyle modification or lifestyle that causes kidney failure is a lack of exercise. Okay, now what happens with exercise is that when you get from the age of, once you are above the age of 40, you need to take exercise very seriously. And the reason is simple, because that is when people begin to have more money, people begin to eat more, people get involved and buried in their work, and so they come home, and then at 8 p.m. they're having a snack. They say, okay, I'm just trying to take a snack and go to bed. But what snack do they have? Ice cream or something that is quick. And this lifestyle at that point makes them predisposed to hypertension and diabetes, and that causes them to have increased risk of kidney failure. But once you increase your exercise rate, what happens is that with exercise, exercise makes you less likely to die from any form of disease. So whether you have arthritis, whether you have hypertension, whether you have diabetes, once you put exercise in the mix, you begin to build muscle, you begin to increase your heart rate, what happens is that you are going to stay longer. I mean, exercise, especially cardio exercises that focus on strengthening your heart, is one of the most important things you can do to your body. A few weeks ago, I had a patient who was 99 years old, and this man was able to talk to me. He was very alert and active, and I was so surprised because I realized that this man had a good heart. He had a pacemaker, so his heart wouldn't stop, and so he wouldn't die. But I'm not saying you should get a pacemaker, but all I'm saying is that when you are able to keep your heart active through exercises like aerobics, or doing a lot of cardio exercises, walking or taking a jog, running, using the treadmill and stuff like that, it increases the strength of your heart muscle. And the longer your heart can work, the longer you are going to live. And so if you're a person who does not exercise at least 30 minutes 3 times a week, then definitely there's something wrong happening, and you must try and have a look at that. Okay, and that is something that's very important. Now the next one is, I think I'm getting this wrong, but I think it's correct. Excessive alcohol intake. Okay, now what happens with excessive alcohol intake is that alcohol intake essentially is going to increase your risk of hypertension, and once you get hypertension, you are ending up at the same level where you are likely to develop kidney failure. Now the fourth one, okay, is overuse of NSAIDs and painkillers. Now, this is very common in a lot of countries. For example, NSAIDs like ibuprofen or Nurofen are very common painkillers. And in most countries, they are over-the-counter medications. They are not controlled, so you can take it anytime you want. And I realized when I was working as a nurse in Ghana that one of the commonest medications people tell you they have taken when they come to hospital with complaint of a pain is that they have taken ibuprofen. Now the problem with ibuprofen, however, is that it inhibits the release of prostaglandins, and prostaglandins is a hormone that causes the dilation of blood vessels, which increases the blood supply to the kidneys or the nephrons. Now when you continue to take NSAIDs like ibuprofen for a long time, you have a restriction of the blood vessels. It becomes narrowed because it has blocked the secretion of prostaglandins, and for a long period of time you begin to have inflammation of these blood vessels in the kidneys and also the nephrons, because they are denied of blood vessels of blood supply and also nutrient supply, and they begin to die off. So a lot of people in Ghana are engaged in a lot of these things. A lot of people, even in the US, are engaged in a lot of these things. You see people having poor eating habits, lack of exercise, excessive alcohol intake. I mean, almost every African country has some small brewery making some form of beer or bitters or whatever, some alcoholic beverage, and they are very poorly regulated. And so what happens is that this intake, coupled with things like overuse of NSAIDs, when they have a headache, they go and take brufen, they just increase their risks of getting hypertension, and also increase their risk of destroying their blood vessels that supply the kidneys, and so there is kidney failure. So I think there should be one last one. I should add one last one, which is smoking. And the thing about smoking is that smoking, when you take things like tobacco, it increases your risk of hypertension. It also damages your blood vessels. Smoking itself damages your blood vessels, and it overall affects the system. Your human system is not going to be the same after you indulge in smoking. And so what happens is that you are going to increase the chances of you developing these disease conditions that I mentioned earlier, which lead ultimately to kidney failure. And so if there's one thing you can do for yourself, you need to focus on these lifestyle habits and take out some of these behaviors or these lifestyle actions. Reduce alcohol intake as much as possible, increase your exercise, reduce the use of over-the-counter NSAIDs like ibuprofen and Nurofen, and you should have a reduced chance of having kidney failure. I hope this video has helped you and it's going to make you reconsider some of your decisions. I mean, the kind of things you eat, the kind of food you take, and so on and so forth. If you have any questions, let me know in the comment section. Send your questions to youtube@manasseh.com and I'll be sure to answer them. Thanks for watching and I'll catch you in the next video.